So 70% of women get an epidural. An epidural has fentanyl in it. That to me, realizing that later was mind blowing. The biggest thing that an employer can do today is cover doula services within their plan. And self-funded employers can do that. It's a strategic decision by hospitals to not inform women that it's fentanyl, because I think a majority of women would pause.
If you end up in the hospital, it will be, the conversations and the recommendations end up being very financial and fear-based.
I'm a very spiritual person, and I will say it's the closest I've ever felt to God in my entire life. And it was the most magical experience of my life. And I realized so quickly, wow, we are robbing women.
Welcome to
The Business of Benefits is your no BS, no sales guide to real solutions.
No gimmicks, just the truth about how to take control, transform your benefits, and care for your most valuable asset, your people.
If you're tired of the same old sales pitch and you're ready to rethink your benefits, this podcast is for you. The truth is out there. Are you ready to hear it?
Hey everyone, welcome to the Business of Benefits podcast. This episode genuinely caught me off guard, so I think you're really going to like this one. There are lots of personal stories and experiences with childbirth and how that affects plan sponsors and mothers. And Chelsea chats with Brittany George, who is founder and CEO of Her Consulting and an author of A Tale of Two Births. So they dive into childbirth, misaligned incentives with doctors and hospitals, and why your epidural has fentanyl in it, which is wild, something I didn't know before this episode. And also what self-funded employers can actually do about maternal health right now. So this one is for plan sponsors and, really anyone who has a woman in their life. You really don't want to skip this episode. So also, if you work in group benefits, imagine spending a few days surrounding by people who truly get it. Professionals who speak your language, understand your challenges, and share your passion for benefits. So, quick sponsor, that's exactly what you'll find at the 45th Annual ISCEBS Employee Benefits Symposium. That's happening August 23rd through the 26th in Phoenix, Arizona. Join one of the nation's largest gatherings of benefits professionals for expert-led sessions, practical strategies, and meaningful networking opportunities designed to help you grow your career. All right, with all that said, I hope you enjoy the episode.
Hi, everybody. Welcome to the Business of Benefits. I am here with a friend and colleague, Brittany George of Her Consulting. Brittany, thank you for being here.
Thank you so much for having me.
I'm very excited today because this is a little bit different of a typical episode that we do, but there's a lot of reasons that I wanted to talk about maternal health specifically. But before we get into that, Britt, why don't you give everybody a rundown of your super unique perspective? Because you've been in insurance, you've been a patient, and now you're an author. How does this all come together?
Yeah, and it really all started with having my daughter. It was really my first time entering the healthcare system, which you talk about this all the time on your LinkedIn and in conversations that we've had, that until you become a patient, you really can't grasp it, no matter how much you sell it, talk about it, study it. And I thought I went in being very informed with my daughter. And I quickly learned how uninformed I really was because we were asking the wrong questions. And you walk out of your birth, and I think a lot of us, and it was certainly this way for me, the most important thing is walking out with a healthy baby. And when you accomplish that, you don't realize what all happened. You kind of leave it all behind. So even though most of us are processing a traumatic birth, I think that's one commonality that most of us share is it is traumatic. And then learning after my second that it really doesn't have to be, that women are born to give birth and we shouldn't fear birth. And then the study and the research I did, because I became obsessed. You and I met when I was at Fountain Health, which was a time when I was learning a lot about how different healthcare can be. The idea of we are all symptom-based care and the machine of healthcare. And so when I really started to study it, myself and realized that the incentives were misaligned. It doesn't matter how great your doctor is and how moral they are when they have a certain incentive structure that goes higher than they are, that it passes their judgment.
Mm-hmm.
And a lot of as women, I think that a lot of our instincts are muted through the experience of giving birth. And then I talk about in my book that my daughter, I love my daughter and my son equally. I love them both differently, but equally. But having my daughter was the worst day of my life. And having my son was the best day of my life. And when I walked out of that, I remember laying both times after having my daughter and after having my son, I laid awake just processing. And it was completely different. With my daughter, it was processing trauma, pulling together all the anxiety that I bottled up. And with my son, I was processing the way that you process like a first kiss, or you process something magical that happened. And I laid awake just knowing that something had happened to me that needed to be shared.
Mm-hmm.
Only 2% of women give birth outside of a hospital, which is crazy. It's a crazy statistic. Going through making the decision to do that, the amount of people that tested my resolve and came against me and just told me, like, are you crazy? What are you thinking? Like, it's not safe. It made me doubt myself. It's just natural to give birth in a hospital. And, I had to write the story. I mean, there was nothing that could stop me from writing this book after having the second experience.
Well, having seen you in more of like corporate Brittany to how you are now, like you can tell you're completely aligned and absolutely fulfilled in what you're doing, which I'm so happy for you. And I can't wait to read the book. So a quick question to get all of our listeners on the same page. Can you share a bit of your experience in the insurance realm and like healthcare financing? And then we'll come back to delivery.
Yeah, so been in various seats in insurance for 17 years. Started off as a health insurance broker from the very beginning. Worked for PEOs, where I spent most of my career is in the PEO space. Sat in different insurance brokerages as well. And then I moved over to Fountain Health, which I talk about in my book is the highlight of my career. Like, it was just an ability to look at things differently, and the way that, they looked at healthcare from, instead of looking at everything as symptom based and we're going to prescribe a prescription, it's looking at a person and the whole person. And it really just changed who I was. And ironically, that was right after giving birth to my daughter.
Interesting.
Yeah.
That makes so much sense with that timing.
Yeah, the timing is wild. And, I believe that there are no accidents in this world. That was, although it unfortunately, Fountain Health is no longer made it, the mission of that statement will live on with me forever. I will move through the world always thinking of healthcare differently because of that period of time. And I started my business, wanting to continue this scope of things as well. So now I founded my own insurance agency, Her Consulting. I'm still doing PEO, but, really focusing on different things than most brokerages are doing, which you do similar work. And I really commend everything that you guys are doing over at Ethos, because it's really incredible. You are a rare one, that's for sure.
I kind of want to lean in a little bit to some of what you just said, which is earlier you talked about the misaligned incentives, right? And so this podcast is very specifically for plan sponsors, and it's to pull back the curtain on the healthcare industry and help them really navigate healthcare financing and healthcare delivery. And how do you, I speak very plainly on the show, like, how do you not get screwed by all the people that are advising you? And how do you ask better questions? And like, there's a lot of things that you've been saying while I've been following your journey with publishing this book about the misaligned incentives with respect to females giving birth and asking better questions. And like that, as much as I love this podcast being about plan sponsors asking better questions and all the things, I think that what you went through is universal. Like, it's plan sponsors, it's plan beneficiaries, it's members, it's patients, it's everybody. And asking better questions, like the power of that is is something that a lot of people don't realize that they can do in healthcare, right? Like you don't really even think that you could ask more of your broker or your carrier or your doctor or whoever. So for anybody listening, this is why I invited Brittany on the show. If you're wondering like, well, how does this connect with plan sponsors and what we normally talk about on the business benefits? This conversation is basically going to be pulling back the curtain. Instead of what we do on the plan level, we're going to be talking specifically about maternal healthcare with respect to childcare delivery. So let's get into that. Can you tell me kind of the typical, especially for the men listening that maybe don't have spouses that have gone through this or family members that have gone through this? Like, what's a typical childcare delivery look like for a woman in the US?
Yeah. So most women, what people don't realize is that most women will be induced. 2% of women will get an epidural. And one of the things, which I don't know about you, there was no doubt with my daughter I was going to have an epidural.
Really?
No question. Because you think about it, from the day you were first hearing about birth, it's the thing by which all pain is measured. Childbirth. So we're conditioned from the very beginning to fear the pain of birth. And so I knew for myself, there was no way I wasn't going to get it. But I didn't realize what the cascade of intervention, what happens with the epidural, that it slows down labor. For one, I didn't know what was in the epidural. Did anybody ever share with you what's in the epidural?
No, I don't know if I've shared with you. I went the very natural route on absolutely everything. So we'll probably really relate over your second pregnancy is my guess. But no, I just know that it's a bunch of toxins. I've heard horror stories, but I will caveat that with, as I'm sure you do, I respect every single woman's decision to give birth however the fuck she wants to. Like that is not my place to intervene.
Yeah, no, and I completely agree, because obviously I have no right leg to stand on to tell women, how they should do it, given that I took the epidural myself. I was terrified, but I had no idea. I think that I went into it just at that point. I just assumed that no one would do anything to harm a pregnant woman, and anything that should be disclosed would be. And I think that's how a lot of us enter. We choose our doctor and we trust the doctor. And we think more information is better. And I learned quickly that more information just means more intervention. So that's one of the things. So 70% of women get an epidural. An epidural has fentanyl in it. That to me, realizing that later was mind blowing. You see images of people on the streets in California taking fentanyl, and here we are giving it to every 70% of laboring women. And not to say that even if you choose it today, knowing that it has fentanyl, it's not here to judge that decision. But I think that women, we want to know that, given that we're not eating sushi, we're not eating deli meat, we're doing all these crazy things. We're told not to drink wine, but then we're given fentanyl, and it does show up in the umbilical boards of 80% of children. So these are things to think about and make your decisions accordingly. And if you choose to still have an epidural, no one's here to judge.
Data-driven decision that sits well with you, right? And that we talk about that a lot on this podcast, about like not only asking better questions, but when you go to act, doing it with integrity, with real data. And I mean, interpret that as you will. Like fentanyl to me is a hard fucking no, but like maybe other people are like, you know what, that is better than something else, the pain or whatever they perceive to be worse. And that's an individual decision.
I think it's a strategic decision by hospitals to not inform women that it's fentanyl, because I think a majority of women would pause. Maybe you get in the pain, you're in the painful crux of it, and then you pivot. But I don't think most women would go in like I did, where it's like, give it to me the second I walk in. Had I known that fentanyl was in it, had I known that taking an epidural means that it slows labor, and that if you're in Pitocin increases the pain of the contractions, and just the whole cascade of intervention that I don't think most of us are aware of. I just went in just saying whatever my doctor says. I don't know if you experienced this, but when I became pregnant, I remember so many people saying birth plan, birth plan, birth plan. And at the time, I thought that was the most insane thing. Like, how can you plan birth? Why? How arrogant of me to think that I can walk in as a first-time mother and plan birth. And I just laughed at anyone else at the time. And now looking back, I realized how important a birth plan really is. And I wish I had put more thought into that looking back of, I need to be able to be an advocate for myself. Birth plans are important, and you are an important piece of this puzzle, and your doctor needs to understand what your birth plan is. But I know you talk a lot about plan sponsors. And I don't want you to think that they, obviously wanting to be on your podcast, I think that there is an important piece of this for plan sponsors, because when you talk about what the cost of it is, at the end of the day, a C-section is double the cost of a vaginal birth. Women are more likely to be, postpartum depression and anxiety and all the things after having a C-section versus a vaginal birth. So there is an incentive for employers to care about this issue. And the biggest piece that they can do, the biggest thing that an employer can do today is cover doula services within their plan. And self-funded employers can do that. Because doulas are not covered by majority of insurance. And even if they aren't, there's ways that you can fund them yourselves for your employers to ensure that your employees, your mothers, the women in your plan, the spouses of your employees, all of those people are able to get doulas services, which statistically is the most meaningful thing that you can do. The bleeding. Gosh, I'm stumbling on the name of it. I wrote this down. The American College of Obstetricians and Gynecologists, they even say to have doula services as the lowest, is the best way to reduce.
Can you explain for people who don't know what a doula is, like what they do and how they support women through pregnancy and also birth?
Did you have a doula, just out of curiosity, on your?
I had a very, very natural OBGYN I tried to do a home birth. It didn't happen that way, unfortunately. But I tried really, really hard. His wife is technically a doula. So yes, but she's also a nurse. So little unconventional. But yeah, absolutely had something like it. And it was the best thing that I feel like I could have had.
I actually, wrote the book at the beginning. When I talk at the beginning of the book, I wrote my intro to my doula because she was absolutely incredible. I credit her fully for one. I also talk in the book about I was processing a miscarriage when I became pregnant with my son. So her helping me reconnect, because I think I was so distracted with one, having carrying a high quota and working through my miscarriage, but also now I'm pregnant again and I want to be happy, but I felt too afraid to connect with the pregnancy because I didn't want to feel that grief again. And she helped me through both that, but also, just making me realize that I had to connect with my body if I was going to have the labor that I wanted. And just being an advocate through everything. What a doula is that's different than, there are three people, the three different roles that we have is, one, we have the OBs, right? And those are the doctors that are trained to give C-sections, and they're obviously going to see you as the case most likely to need a C-section. So if you go to an OB originally from the start, you're more likely to get a C-section than if you choose a midwife. And then you have a midwife, they're a lot more flexible. They're not going to rush to a C-section because they're not trained to do a C-section. So you're less likely to have a C-section if you have a midwife. But a doula isn't even a medical practitioner at all. She's really to support you. And what I didn't realize is that your body, when you're in fear mode, you're contracting and it makes labor more painful. And so what she's doing is just keeping you calm, reminding you that you're capable and just being your advocate through it all. And I talk about this, my husband, my wedding was one of the most beautiful weddings. It was such a romantic day. My we've had many romantic moments throughout our marriage. I love my husband so much, but the day that I gave birth to my son was the most romantic day of my life. My doula set him up to know what to do, to be able to be there and be an advocate for me. Just him counting him telling, he wants to be always my savior. He wants to do everything. Him to have a role and to be able to step into it and count the contractions and hold on to me and like sway with me, all these things. It was just because of her, we had the most romantic day of our lives in my mind. And I think that doulas are, I mean, I would have paid her 10 times what I paid her now looking back.
Speaking of cost, like if an employer is listening to this and they're like, oh, that's really interesting, a self-funded employer that could add something like this to their health plan, what do you foresee as the maybe price range for a doula services?
So doulas are range between $2,000 to $10,000 of where they were, but it's just cutting the cost of your labor in half. I mean, or your delivery in half. I mean, that's a savings at the end of the day. I mean, you talk about NICU babies is one of the most expensive things a plan can have happen. It's in the top 10 most expensive costs. So if you're avoiding these things, you're more likely, obviously, with a C-section to have a NICU stay. So you're avoiding so many downstream costs. If you're only segmenting and looking at different financial aspect of having the actual labor, it's just so much more.
I would compare it to how we teach about direct primary care. So when you have direct primary care embedded in a self-funded health plan, you have that guide, that concierge essentially, where the patient can get same day appointments, but they also understand the playbook of the health plan. So if there's an MSK issue, they can guide you to that point solution. If there's a cancer diagnosis, and they can guide you to the direct contracts with the cancer centers. And it's in terms of experiencing healthcare, it's incredible because you're being told what to do that's going to be not only the best for you, but the best price as well, right? Right care at the right time at the right price. And I always think about doulas as sort of like the direct primary care for birth. And a lot of the times employers will say, oh, direct primary care, like that sounds really cool, but I mean, $100 somewhere around there a month per employee, that's expensive. And it is, but immediately within 6 months, you see 30% reduction in ER visits. You can see a huge difference in claims, especially once you have data for a year or two. Think for plan sponsors listening to this that are like, ooh, this doula thing sounds a little crazy. Think of it like that. And that's what Brittany means by the downstream impacts of mitigating cost.
Yeah. And it's like, even if you think about getting back to work, your mother's feeling supported, because after you give birth, I mean, with my first, it's like, here's your baby, go on and live your life. And, with my son, my doula came over, she came to my house afterwards, held my son, helped me through, connected me with my lactation consultant, like all the things. So she was just, Candace, I love her. She changed my life. This book wouldn't have been possible without her. And I just think that everyone should have that. I mean, no woman should go through birth. I mean, other countries who have better, that's the biggest thing is we in America pride ourselves on having the best healthcare. And we say that all the time, but we actually, when you look at it, the numbers aren't there. It's not proven. We have the best innovation. As far as outcomes, we're struggling, and maternal outcomes are getting worse, not better.
No, you're absolutely right. So another reason that I wanted to have you on the show is because the amount of women that I know personally and professionally who, whether it's after child delivery and they're in that sort of postpartum era, like myself, actually, or even before that, if they're dealing with infertility or trying to conceive and having issues, all the way to women who are perimenopausal or actually in menopause, the hormonal experiences that the women in the workforce are experiencing is very detrimental to their work. And they're having a really fucking hard time, myself included, balancing what it's like to be postpartum, sleep deprived, memory loss, operating at what I honestly feel is a fraction of my normal capability, right? And even women in menopause, it's the exact same thing, memory fog. Like, it's obviously different parts of life, but very similar symptomatically of like, you just don't feel your best as a professional because you're giving so much somewhere else. And the workforce is just not designed to support that. And employee benefits, the way that traditional ones work, are not in any way designed to support women through various stages of life. And having gone through this, I'm so passionate about like trying to figure out, how do we get fertility benefits into companies that need it? How do we help them create postpartum packages that actually make sense and serve people? The 6 to 8 week thing is fucking bullshit. let's just call it what it is. Like, I come from Canada, and I'm from Canada. Holy redneck much. And the maternity leave is a year. It's literally a year and you can extend it to a year and a half.
Right.
And guess what? Employers pay for that.
I know.
Wild. But we are underserving women in every single one of our plans. Like, I know that we are. And I know it's costly. It's just like, it's something that we really got to figure out.
And not only that, it's like when you think about C-sections and what they mean, you think about when I was in my hospital birth with Hazley, I was almost going to get a C-section. They said, we're prepping the room for a C-section. It almost happened. And I shared the story of how this all happened and almost had one. And now looking back, all I thought about at the time was the scar. And most women, when they think about C-section, like, oh, whether she has a scar, you see other people that have just gotten through it, because that's what women do. We always just get through these difficult things, and no one really understands the scale of what we're pushing through. And just because a woman, you have 10 friends that have had C-sections and they have healthy babies, we don't think about what the long-term impact of a C-section is, what it means to get the bacteria that goes through your vaginal canal. What they're studying now is seeing that kids are more likely to have issues with asthma and obesity and all of the things. So there's this downstream impact of these dependents that will be on your plan. So if you're only thinking about it, even at the dollar for dollar, just looking at that, it's so much more.
Yeah. I mean, I've seen C-sections hit our plans that are 80, 90, 100 grand plus, whereas vaginal deliveries are in the 20s. On our reference-based pricing plans, $6,000, $7,000, $4,000 is the actual, like, that's 125% of Medicare, of what Medicare is paying, or 125% times what Medicare is paying, and versus $100,000 C-section, where, to Brittany's point, outcomes are less or worse. And it's not, having had one, unfortunately, an emergency one, it's awful. Like, I would never want anybody to have to go through that. And it's just such a far cry from, what you envision, I'm sure. Like, I don't think anybody wants to. Actually, it is interesting to me that some women do elect this, because that is a thing too. But that's a story for another day. Yeah, to me, the only thing I keep thinking about is we have a client that unintentionally, we have a reference-based pricing plan. And I think this plan, within the last 2 plan years, there's been 4 or 5 women that have gotten deliveries for free, absolutely no cost. It's just the way that they designed the plan, which I think is really, really special.
Oh, that's awesome. I mean, that's absolutely incredible. And if you're, I think that a lot of my nanny, for example, we're obviously different incomes, and she really wanted to have something similar, but it's, you kind of don't have a choice at a certain level within plans. You have to stick to what your plan offers. And for me, being able to go to the birth center, I wanted to do a home birth like you. I just could not get my husband on board, and it was important for me that he was calm and steady through it. So the birth center was a compromise ultimately for us, because it felt like somewhere that had a safety net for him. But for most people, if the birth centers are closing all over the country, a lot of women are extremely far from one or don't have access to one at all, which is unfortunate. And so they don't have that level of compromise. You're forced into a hospital birth if you don't have a birth center near you. And so when we chose our birth center, my nanny wanted to, but it wasn't covered with an insurance, and she couldn't get a doula and all these things. So I just felt for her of what that means and how many women don't have access to these tools that we're fortunate enough to we get. And, we know that we want, and that every woman should have access to. Every woman should have the birth that they want and the outcome that they shoot for at the end of the day. And sometimes C-sections are important. Sometimes people need them. There are emergency situations where C-sections, they're the only choice. But unfortunately, it's a lot of doctors just jump to it, unfortunately, because the incentives are misaligned. And if you're not asking the right questions, and you don't have a doula there to support you and help you make that call when, the stress of the room and the white coats come in. Yeah.
Yeah. Right. Like it's from experience. It's just, if you end up in the hospital, like, it will be, the conversations and the recommendations end up being very financial and fear-based, which in healthcare, both of those are not great. So,
Yeah.
So I want to go back to the book a little bit. So the book, guys, is called A Tale of Two Births, and it's an insider's perspective on risk, incentives, and reclaiming birth. And Britt, you say trusting a system and understanding it are two entirely different things. I think for those people that listen to this show, they probably have a little bit of mistrust in the system inherently, because if you've been following along, it's pretty messed up at all levels. So I don't think our listeners are going to be surprised by the trust, and that, it's not aligned. But I think it would be helpful for you to maybe just explain like the differences between the two births and some of those outcomes.
Yeah. So with my daughter, I went in and I was so naive. So my daughter was my first, and throughout my pregnancy, they have a lot more, when you're in a hospital birth, you're going to have a lot more doctor's appointments. And I took every doctor's appointment. I wanted to have every ultrasound. I'm over, with my daughter, I was over 35. So geriatric pregnancy, you automatically get more ultrasounds. Yeah. What I didn't know is the more they look, the more they're likely to find. And so even though I told them my daughter isn't very active during the day, on that particular day, I didn't eat enough sugar, running around in corporate America, just grazed on food, which made her less mobile. I told that to a doctor, which then was the beginning of me being admitted and getting induced. And so they induced labor because they said she had low movement and low heart rate. And so the solution was Pitocin, which gives babies reduces the heart rate of babies. And so here we are, they're monitoring, and I'm very active. They knew my resting heart rate was below 60 beats per minute, which is the parameter. And if you're below that, your alarm's going to go off consistently. So for 36 hours, an alarm went off in the room. So if anybody knows, everybody who's had a baby knows what it's like to be sleep deprived, but you don't know what it's like to be up for 36 hours in labor. Mm-hmm. And so the difference of that was just when my daughter was handed to me, I just remember been told my whole life this would be the most magical thing that ever happened to you. And I felt like such a failure as a mom because all I could think about was, okay, she's okay. Someone take her. I need a minute. I didn't want to hold my daughter. I just I knew she was okay, but I just needed a second to just be by myself and process like, holy crap, what just happened? And, I go through like what happened afterwards and, the staying in the room with other people because it was during COVID. So we shared a room with another couple, which is just 10 out of 10. Don't recommend that. Yeah. I walked out of that. And the irony is at the time, the biggest moments weren't what they should have been, was the time leading up to it. It was just all I could think about was the sleep deprivation. And I was going to do everything I could to avoid being trapped in a hospital again. Mm-hmm. And I knew that. But with my daughter or with my son, going through the experience of just being completely anti-hospital for birth for myself, like I just knew that was not the route I wanted to go. Mm-hmm. And I was going to do everything within my human power to stay out of that. But I still was doing the wrong things until I hired Candace. And Candace really helped me, remind myself of all the things I knew. You got to meditate. You got to be in touch with your own intuition. You are an important piece of this healthcare puzzle. Birth is not. It's not a medical event. Mm-hmm. It's the most natural thing women have done for centuries, and you're capable of it. And having that birth, I was still scared. I remember every time I would speak to anybody and tell them that, because I was at the time selling through a lot of health insurance brokers. And a lot of men, I worked with a lot of men, and a lot of men were just like, are you insane? Or they would say, oh, you're crazy in a laughable way, but which really meant that you're a psychopath and it's just dangerous.
Yeah.
Own family members thought I was doing something that was completely dangerous and reckless. I would doubt myself constantly. I'm so glad that I pushed through it and did it anyway. Having that experience, I remember walking and having early labor. And my doula had said something about some women have orgasmic births. Mm-hmm. Walking in, phase 1 isn't that bad. And I was like, oh, be one of those orgasmic birth. And then phase 2 hit, so the active labor hits, and I was like, oh, definitely I'm not. But it was painful. And I thought that the next phase would get more painful. So you automatically just assume transition is going to be, if I'm in this and this hurts this bad, transition is going to be worse. So I started really questioning myself. But the rush of hormones and all the things that happen as your body opens up, I'm a very spiritual person, and I will say it's the closest I've ever felt to God in my entire life. And it was the most magical experience of my life. And I realized so quickly, wow, we are robbing women. We're robbing women of this experience, the moment that will make you forever feel like the badass bitch that you are.
For sure.
You were born to do this. Nobody in a white coat gets to take this from you. You get to have this experience if you want to. It's just that the system just not aligned. A lot of women will not even have the opportunity to give birth the way that I did. And that just makes me really sad.
Me too. And I think there's this thing that kind of keeps resonating in my head, which is like, we have to advocate for ourselves. And I think everybody knows that, like in the healthcare system, like you have to advocate, and and I'm even thinking not even just birth, but like even when I was just going for my annual checkup, like being dismissed constantly, and never mind women's mental health. I mean, that's a whole other thing, right, that we could talk about. But women in general, when experiencing healthcare, are often so dismissed. And to your point, we are literally doing the most powerful, godlike work that is even possible, right? Like on this side of the world, in this earth that we're living in, like what could possibly be more important? And we're constantly robbing our sense of like purpose and ownership and worth. Yeah, it's unfreaking believable. And it's really cool to hear you kind of talk about like some of the things plan sponsors can do, like the doula. Are there any other like recommendations that you would have for plan sponsors on how they can support women to have a more empowered experience?
I mean, I would say the doulas is like the number one thing that anybody can do to right now, today. We don't have to wait on legislation. I'm not done with this work. That's ultimately what my life passion is going to be, to lobby to Washington and, to the state of Florida where we live, to ensure that it starts to get covered within insurance plans. But self-funded employers can do that today. You don't have to wait around for, Florida Blue and Aetna and all the other insurance companies to make a move.
Thing. Yeah, you'll be waiting a while.
You don't have to, wait. And this will absolutely move the needle. And the women who get these benefits will be loyal employees.
Yes.
If you're able to offer them this simple thing, at the end of the day, that you'll be a unique employer. When everybody's trying to do something different within their plan to move the needle, that's something that's different. Yes, I think paternity benefits, all the things, but this is way bigger than that.
And we're doing it like it's being done shitty. So why don't we focus here first? Right? Like let's solve one problem at a time. I absolutely love that advice. I think that as always, kind of the take-home message is we as plan sponsors have so much more power than we realize, but also we as patients, we as women, especially in this process of giving birth and, continuing humanity's existence as we know it. It's like a small, like little thing, right? No, it's incredible. So I just want to thank you, number one, for like being an insider in this industry and knowing how it works, and then having the experiences that you've had. I mean, it always begs the question of like the people who don't know what we know, right? That don't understand insurance and don't understand the power of advocating for yourself. Like those are the women that I really hope get your book and like get this message too. But just thank you for the work that you're doing and for encouraging plan sponsors to include doula benefits. I think that's fantastic. Any last parting words or thoughts for our listeners?
Yeah, I hope that any woman, that ultimately reads this book, that they don't walk away if they've already given birth and feel judged or like they made the wrong decision, because I think that few of us can sit there when we're looking at a doctor in a white coat and feel confident if we don't have the information. But the thing that you can do to move it forward is share this story with other women so that they have the right information. I've given birth in a hospital and outside of a hospital. I will choose outside of a hospital every single day. But if you still choose the hospital, just having this information, going in and being armed with it will help you. Be a student, have a birth plan, even if your employer is not offering it. And for employers, definitely consider doula services, because it will be the most meaningful, impactful benefit that you could do for the women who are bringing people into the world.
Thank you so much for being on the show. And guys, we're going to link Brittany's LinkedIn and the link to her book, A Tale of Two Births, a Memoir and a Critique. Thanks, Britt.